Welcome back to Make It Make Sense Monday. I'm Professor Perkins, and today we're talking about coronary artery disease, or CAD. If you've ever wondered why patients develop chest pain, why plaque buildup matters, or how CAD can lead to a heart attack, you're in the right place. Because nursing doesn't have to be complicated. Let's make it make sense. Let's start with the basics. Coronary artery disease, or CAD, occurs when plaque builds up inside the coronary arteries. These arteries are responsible for supplying oxygen-rich blood to the heart muscle. Over time, cholesterol, fat, and other substances collect along the artery walls and form plaque. As plaque accumulates, the artery becomes narrower. The narrower the artery becomes, the harder it is for blood to reach the heart. And when blood flow decreases, oxygen delivery decreases. That's where the problem begins. Now let's make the process make sense. First, plaque begins to form inside the artery wall. As the plaque grows, the opening of the artery becomes smaller. Less blood can move through the vessel. When blood flow decreases, oxygen delivery to the heart muscle also decreases. The heart still needs oxygen to work effectively, especially during activity. When oxygen demand becomes greater than oxygen supply, symptoms begin to develop. This mismatch between oxygen supply and oxygen demand is the foundation of coronary artery disease. One of the most common symptoms of CAD is angina. Angina is chest pain caused by decreased oxygen delivery to the heart muscle. Patients often describe it as pressure, squeezing, heaviness, tightness, or discomfort in the chest. Some patients experience pain that radiates to the jaw, neck, shoulder, or arm. You may also notice shortness of breath, fatigue, or difficulty tolerating activity. A patient may tell you they become tired more easily or can't do things they used to do without stopping to rest. These symptoms occur because the heart isn't receiving the oxygen-rich blood it needs. Here's your signature key. Narrow pipes, less blood flow, protect the heart. That's it. If the arteries become narrow, less blood can travel through them. Less blood flow means less oxygen reaches the heart muscle. Less oxygen means a greater risk for chest pain, decreased cardiac function, and future cardiac events. Whenever you're studying CAD, come back to this key. Narrow pipes, less blood flow, protect the heart. As nurses, our priority is assessing cardiac perfusion. We want to determine whether the heart is receiving enough oxygen-rich blood. Pay close attention to chest pain patterns. When does it occur? How severe is it? What makes it better or worse? Assess activity tolerance, oxygenation, and vital signs. Listen carefully to what the patient tells you. Many times, the patient's symptoms provide the earliest clues that perfusion is declining. Always ask yourself, is the heart getting enough blood and oxygen? That's the question we're trying to answer. Certain findings should immediately get your attention. Chest pain occurring at rest is a major red flag. Increasing frequency or severity of angina is another warning sign. Shortness of breath that is worsening over time may indicate progression of disease. Syncope or fainting should always be taken seriously because it may suggest inadequate cardiac output. These findings can indicate worsening coronary artery disease and increased risk for myocardial infarction. Strong nurses recognize these warning signs early and act quickly. Here's your clinical judgment takeaway. Stable angina is predictable. It typically occurs with exertion, emotional stress, or increased activity. It improves with rest or prescribed medications. Unstable angina is different. It may occur at rest, it may happen more frequently, and it may become more severe over time. Unstable angina is dangerous because it often signals that a myocardial infarction could be approaching. Strong nurses don't just recognize symptoms, they recognize patterns. They anticipate complications, and they intervene before the patient deteriorates. Assess before you diagnose. This is the signature nurse. Nursing success starts here. And remember, because nursing doesn't have to be complicated, let's make it make sense.